Hello my geniuses, welcome to another lecture today on my head and neck series. We'll be talking about the posterior triangles of the neck. So the posterior triangles. So bilateral posterior triangles is very important to know. It's also a clinical question for those preparing for the second professional exams. So it's very important, or you are preparing for any medical exams. You also need the triangles of the neck too, so which I'll be breaking down small. So what is the posterior triangle? So we have the anterior triangle and you have the posterior triangle. So the anterior triangle is when you are looking forward, the front of your neck, that's the anterior triangle. But if you look at the side of your neck, you see the posterior triangle. So in the posterior triangle, what is the posterior triangle? The posterior triangle is a triangular space at the side of the neck behind the sternocleidomastoid muscle. So notice it's a triangular shaped space at the side of the neck behind the sternocleidomastoid muscle. Don't forget, its apex is directed upwards and backwards toward the mastoid process and the base of the clavicle. So you can see it in between the mastoid of the skull and the clavicle. So the mastoid in front, I get it now, which is of the skull, and the clavicle below. You get it now. So one is a triangular shaped space which is located at the side of the neck behind the sternocleidomastoid muscle. So upwards you can see the mastoid process, upwards, below you can see the clavicle. So what are the boundaries of the posterior triangle of the neck? So the boundaries, first of all, what can you see? Anterior. You can see it in your screen. The anterior, you could see the posterior border of the sternocleidomastoid muscle, while the posterior you can see the anterior border of the trapezius muscle. That's all you can see. Now what can you see inferior now, which is the base? So now you can see the superior aspect of the middle third of the clavicle. So that is the center, the middle third of the clavicle in the superior aspect. That's what you can see, that's related inferior to the posterior triangle of the neck. Now what can you see at the apex? Apex is the meeting point, which is apex means superior to. Now you have the superior of the apex, you have the inferior of the base. So the superior of the apex, what can you see there? You can see the meeting point of the sternocleidomastoid and the trapezius muscle at the superior nuclear line of the occipital bone. So at the superior nuclear line, which you see that line, which I'm showing you now, you can see the meeting point of sternocleidomastoid and the next one, which is the trapezius muscle at the superior nuclear line. Now the next thing here is, what can you see at the roof? Now you have the roof, you see the floor. What can you see at the roof? The roof, you can see, first of all, you have the skin, you have the superficial fascia. Now you have a deep fascia. What is the deep fascia? You have the investing layer of the deep cervical fascia. The investing layer of the deep cervical fascia that stretches between the sternocleidomastoid and the trapezius muscle. So but in the superficial fascia that you also have the roof, what can you see there? You can see the platysma muscle, which we'll discuss. You can see the external jugular and you can see the posterior jugular vein with so many cutaneous nerves and vessels. I get him now. So many cutaneous nerves and vessels. And you can also see some cutaneous branches from the cervical plexus that pierces through the roof. So what are the cutaneous nerves? You can see the lesser occipital nerve, which is C2. You can see the greater auricular nerve, which is C2, C3. You can see the transverse cervical nerve, which is C2, C3. And you can see the suprascapular nerve, which is C3, C4. These are branches from the cervical plexus that supply cutaneously. So if they say the roof is the skin, superficial fascia, which contains nerves and vessels, and you have the deep fascia, which is investing deep cervical fascia. Now what can you see in the floor? So we have the roof, we have the floor, we have said about the one that is anterior, posterior, apex and base. So what can you see at the floor? You can see now, don't forget, you can first of all see the semispinous capitalis, you can see the sinus capitalis, you can see the levator scapulae, you can see the scalenus medius, and you can see the first digitation of the serratius anterior sometimes. So you have seen the semispinous capitalis, you can see the spinous capitalis, you have the levator scapulae, you can see the scalenus medius and the first digitation of this serratius anterior. You get it now? So simple. So now another thing you have to know now, there is what we call the subdivision. The posterior triangle of the neck is subdivided into two by the inferior belly of the omohyoid. So the belly of the omohyoid, inferior belly, is coming from the scapula. So when it's coming from the scapula now, which is about the superior border of the scapula, so when it comes, it crosses through the posterior triangle of the neck, form a superior belly of the omohyoid before inserting on the hyoid bone. So that inferior belly of the omohyoid, do you get it now? So it has the inferior belly of the omohyoid and the superior belly, so they form an aponeurosis. So the first of all, when this inferior belly is coming from the superior border of the scapula, they pass through the posterior triangle, then it now form an aponeurosis and continue as the superior belly of the omohyoid, get and insert on the hyoid bone. So when it crosses the posterior triangle, it divides it into occipital triangle, which is on top, and you have the subclavian triangle below. Occipital triangle is much larger, and the subclavian triangle below. So very, very simple to what transverse to this triangle. What are the contents? So we have the introduction, we have the boundaries, now we have the contents. So what's the contents? So we'll talk about the content in the occipital triangle, which is above the omohyoid, and the content in the subclavian triangle below the omohyoid. What are the content above the omohyoid, which is the occipital triangle? So you have the spinal accessory nerve, normal, the spinal accessory nerve. You have the third and fourth cervical nerve. The third and fourth cervical nerve are branches from the third and fourth cervical nerve are branches to the levator scapulae and the trapezius muscle. So you have the dorsoscapular nerve, which is the first branch in the root from the brachial plexus. Are you getting me now? So you have the four cutaneous branches of the cervical plexus, very, very important. So you have C1, C2, C3, C4 that supplies a lot of stuff. Now you have the superficial transverse cervical artery. Superficial transverse cervical artery, don't forget it. And you have the occipital artery. So you have the occipital triangle, you have the occipital vessels. You get it now? So again, the occipital artery, superficial transverse cervical artery, four cutaneous branches from the cervical plexus, the dorsoscapular nerve, the spinal accessory nerve, and the 3 and 4, which supplies the levator scapulae and the trapezius muscle. Now in the next one, you have the subclavian triangle below the omohyoid. So what do you see? You have the third part of the subclavian artery, the third part of the subclavian artery. You have the subclavian vein, normal. You have the terminal part of the external jugular vein, don't forget. So third part of the subclavian artery, the subclavian vein, the terminal part of the external jugular vein. You have the trunk of the brachial plexus normally. So when the brachial plexus is coming from the root, which is from the back of the neck, it passes through the side of the neck, forming the trunk, superior, middle, and inferior part of the trunk. So go and watch my brachial plexus video. So the next one is the superficial transverse cervical, suprascapular, and the dorsoscapular arteries, and you have lymph nodes. So very, very important. So what you can see in the content of the posterior triangle, the major thing is the third part of the subclavian artery, the brachial plexus, which is the trunk part, the spinal accessory nerve, and lymph nodes. So you can see a vessel, a nerve, and lymph nodes. So listen to it very well and follow it 100%. It's better you know it and you don't forget it. So very, very important. So you can also block the brachial plexus in the triangle of the neck. So when you inject some substance, maybe they want to carry out any procedure at a particular point, they could put a local anesthesia in that area between the first rib and the skin over the clavicle. So when they inject the local anesthesia, they can block the brachial plexus around that area to perform any surgical procedure in the upper limb. Also, there is a pulsation of the subclavian artery at the roof of the neck. So when you press behind the clavicle, in the posterior border of the sternocleidomastoid, it's always helpful. There's pulsation there. So the hemorrhage from the artery of the upper limb can be stopped by pressing the subclavian artery on the first rib. You get it now? So I hope it all makes sense to you and you understood everything I've talked about in the posterior triangles of the neck. Very, very easy. I make it very, very easy. Follow it. You'll be seeing it on your screen. Follow it. Like, subscribe to my video. So if you have a question, you also ask me. So I'll be seeing you in my next video. Bye bye.